Our study had the aim of looking at cognitive or intellectual outcomes in patients who survived cardiac arrest. Essentially, a significant minority of people after cardiac arrest achieve full recovery of intellectual function, and the rest of the patients, there are some who have relatively severe impairment of memory and other mental capabilities, while others are left with borderline function that probably could be helped with rehabilitation. Certainly that is something that needs to be studied. The cognitive outcome of cardiac arrest survivors has not received enough attention thus far. Most of the previous studies have focused on the performance of these patients, on the daily activities rather than on intellectual recovery. And perhaps there are interventions that can be used, but first you have to identify the problem. I think that the next thing that needs to be studied is whether hypothermia, which is now an established treatment to try to preserve the brain from the deleterious effects of lack of oxygenation and blood flow during the cardiac arrest, whether that intervention of hypothermia can improve cognitive outcomes in these patients. And the other thing that should be assessed is whether interventions initiated shortly after this cardiac arrest, such as brain rehabilitation programs, could help patients recover intellectual function more fully.